Hepatitis C is also known as the silent killer. It is a virus transmitted by coming into contact with infected human blood.
Hepatitis C can lead to liver damage. According to the CDC, hepatitis C is the leading cause of liver cancer and liver transplants in the U.S.
It can lead to death.
Hepatitis C does not discriminate.
Hepatitis C does not discriminate.
Patients with hepatitis C are seen in all levels of care, including in up to critical care unit and hospice.
The highest prevalence of hepatitis C in the U.S. is among injection drug users. 66.2% of those that have been using injection drugs for less than 9 years have hepatitis C.
The statistics skyrocket from there. 87.6% of injection drug users who have been using drugs for 10 to 19 years have hepatitis C.
For those that have been using for 20 to 29 years, 97.6% have hepatitis C.
And 98.7% of those who have been using injection drugs for greater than 30 years have hepatitis C. In contrast, 22.2 to 52.5% of those who are homeless have hepatitis C. 23.1 to 41.2% of those who are incarcerated have hepatitis C.
5.1 to 10.7% of veterans have hepatitis C, and only 1.6% of the U.S. population as a whole have hepatitis C.
This information was found in an article from the National AIDS Treatment Advocacy Project.
Hepatitis C virus is spread when in contact with contaminated blood. Therefore, you cannot get hepatitis C from hugging, sneezing, kissing, coughing, sharing food or water. However, you can get it through blood transfusions and organ transplant before 1992, sharing needles, and in rare cases, an infected mother can spread it to her newborn. Also, in rare cases, hepatitis C may be transmitted sexually.
Persons with newly acquired hepatitis C are usually asymptomatic or have mild symptoms that are unlikely to prompt a visit to a healthcare provider. Symptoms include fever, fatigue, dark urine, abdominal pain, nausea, vomiting, joint pain, and jaundice.
The goal of nursing management is to allow the liver to heal with rest and nutrition. For example, bed rest, a high caloric intake, specifically small frequent meals, high in carbohydrates, low in fats, and low in proteins. Part of our job is informing those with hepatitis C how to prevent the progression and transmission of the disease as previously discussed. It is also important for those with hepatitis C to keep away from others that are ill since they are more susceptible to illness.
Exacerbations, or what makes hepatitis C symptoms worse, include alcohol use, drugs harmful to the liver, for example Tylenol or Motrin, weakened immune system, sleep problems, or vigorous exercise.
Hepatitis C should not be taken lightly. Upon receiving care, patients ought to be proactive in following up with their healthcare provider or community public health office. The CDC and California Department of Public Health offers many resources, which include Hepatitis C Connection National Support Group lists with a contact right here in this city, as well as the Stockton After Hours Medical Clinic for Women.